One Paw at a Time, Animal-Assisted Rehabilitation for Stroke Patients. Title: One Paw at a Time, Animal-Assisted Rehabilitation for Stroke Patients. Introduction. Stroke, a leading cause of disability worldwide, often leaves survivors with lasting impairments that affect their physical and mental well-being. While traditional therapies play a crucial role in stroke rehabilitation, a novel and promising approach has emerged: animal-assisted rehabilitation. This innovative technique involves integrating animals into the rehabilitation process to enhance patients' motivation, accelerate their recovery, and improve their overall quality of life. This article explores the benefits and effectiveness of animal-assisted rehabilitation in stroke recovery, highlighting the profound impact our furry friends can have on patients' well-being. Understanding animal-assisted rehabilitation. Animal-assisted rehabilitation involves the incorporation of animals, such as dogs or horses, into the therapy sessions for stroke survivors. These animals act as co-therapists, working alongside the healthcare professionals to aid in the recovery process. The human-animal bond is believed to provide unique emotional support, encouragement, and motivation to patients, which in turn boosts their engagement in therapy and overall progress. Physical benefits of animal-assisted rehabilitation. 1. Improved motor function. Interacting with animals requires stroke patients to engage in physical activities such as petting, grooming, or walking them. These actions stimulate motor function, helping patients regain muscle control and coordination. 2. This can lead to improved range of motion and joint flexibility. 3. Enhanced balance and gait. Walking or engaging in rhythmic movements while accompanied by animals can improve patients' balance and gait. The presence of a four-legged companion provides additional stability, making patients feel more secure and confident during their rehabilitation exercises. Psychological benefits of animal-assisted rehabilitation. 1. Emotional support. Animals have an incredible ability to provide unconditional love and emotional support. Stroke survivors often struggle with emotional distress, depression, or anxiety during their recovery journey. Animal-assisted therapy helps alleviate these negative emotions and provides a sense of companionship, reducing loneliness and promoting overall well-being. 2. Increased motivation. Incorporating animals into therapy sessions can significantly boost patients' motivation, as they look forward to interacting with their four-legged partner. This heightened motivation translates into increased compliance with therapy exercises and a more positive attitude towards the recovery process. 3. Stress reduction. Stroke recovery can be a stressful and overwhelming experience. Animal-assisted rehabilitation has been proven to reduce stress levels, decrease blood pressure, and improve overall psychological well-being. The presence of animals induces feelings of calmness, comfort, and relaxation, creating a conducive environment for healing. Social benefits of animal-assisted rehabilitation. 1. Improved social interaction. Animals serve as non-judgmental intermediaries, often bridging the gap between patients and their healthcare providers. The presence of animals enables patients to open up, communicate, and develop a stronger rapport with their therapists, leading to more effective rehabilitation. 2. Facilitated peer interaction. Animal-assisted therapy promotes socialization among stroke survivors. Group therapy sessions with animals create a relaxed and enjoyable environment, encouraging patients to interact with each other, share experiences, and form friendships. These social connections foster support and motivation throughout the recovery process. 3. Community integration. Engaging in animal-assisted rehabilitation offers an opportunity for stroke survivors to reintegrate into their communities. Walks with therapy dogs or visits to community Enters with animals give patients a chance to participate in society, access public places, and interact with the community in a meaningful way. Effectiveness of animal-assisted rehabilitation in stroke recovery. Numerous studies have shown the positive impact of animal-assisted rehabilitation on stroke recovery. These outcomes are attributed to the unique bond between humans and animals, as well as the enjoyment and motivation derived from working with animals. Animal-assisted rehabilitation in pediatric patients. Animal-assisted rehabilitation is not only beneficial for stroke patients but also holds great potential in pediatric rehabilitation. Children with various physical and cognitive disabilities can experience similar advantages through therapeutic interactions with animals. By incorporating animals into their rehabilitation sessions, young patients can benefit from the physical, psychological, and social aspects of this innovative approach. Physical benefits for pediatric patients. 1. Increased motor skills. Children with disabilities often struggle with motor skills development. 2. Improved balance and coordination. Performing exercises or engaging in activities with animals encourages children to practice proper balance and coordination. The presence of animals can motivate them to push their limits and improve their overall physical abilities. 3. Enhanced sensory integration. Many children with disabilities experience difficulties in sensory processing. Interacting with animals can stimulate their sensory systems, supporting the development of their sensory integration skills. Activities like petting, grooming, or walking animals provide tactile, auditory, and visual feedback, contributing to the child's sensory understanding. Psychological benefits for pediatric patients. 1. Emotional well-being. Animal-assisted rehabilitation offers emotional support and companionship to pediatric patients. Animals provide unconditional love, comfort, and non-judgmental interactions. Nurturing the child's emotional well-being. This is especially significant for children who may struggle with anxiety, depression, or emotional challenges due to their disabilities. 2. Increased motivation and engagement. Therapy sessions involving animals naturally increase children's motivation and engagement. The opportunity to interact with furry friends creates enthusiasm and joy, motivating them to actively participate in the rehabilitation process. This heightened engagement can lead to faster progress and better treatment outcomes. 3. Reduced stress and anxiety. Children with disabilities often face high levels of stress and anxiety. Animal-assisted therapy helps alleviate these feelings by promoting relaxation, reducing stress hormones, and providing emotional comfort. Interacting with animals can distract children from their worries, creating a calm and soothing environment for therapy. Social benefits for pediatric patients. 1. Improved social interactions. Animals act as catalysts for social interactions, especially for children who struggle with communication or social skills. The presence of an animal can reduce social barriers, encourage communication, and facilitate positive interactions between the child, therapists, and peers. This improved socialization can have long-lasting effects on the child's overall social development. 2. Increased self-esteem and confidence. Animal-assisted rehabilitation helps boost children's self-esteem and confidence. The non-judgmental nature of animals allows children to feel accepted and valued, improving their self-perception and self-worth. Developing positive relationships with animals can transfer to improved self-confidence in their daily lives. 3. Supportive community integration. Engaging in animal assisted therapy enables pediatric patients to participate in community activities and integrate into society. The effectiveness of animal assisted rehabilitation in pediatric rehabilitation. Research studies have shown the positive impact of animal assisted rehabilitation on pediatric patients with disabilities. The benefits observed include improved motor skills, increased social interaction,